Two notes about this press conference. Tomorrow, the press conference will be at 2:30, and then we'll pick it up again the day thereafter at 1 o'clock. And then starting next week, I am only going to hold these press conferences Monday, Wednesday, and Friday at 1 o'clock every day. So we're in phase 2 now. Things are looking different everywhere, and this will start to look different too. So 1 o'clock today, 2:30 tomorrow, starting next week, Monday, Wednesday, Friday, 1 o'clock. I would encourage you to continue to tune in if you can. If you want to sign up for daily emails, please go ahead and do that. Also, continue to look at reopeningri.com. We're going to add details to that continuously. I will say, as questions come to us, how do we reopen this venue? How do we handle this? We're going to endeavor to constantly post all those details and that detailed guidance at reopeningri.com, so please continue to consult that, particularly if you're a small business. I also want to thank the members of the press who are here today and who have been here every single day. I was just with many of you an hour or so ago addressing what happened in Providence last night. Like a lot of us, you guys are working overtime, and I greatly appreciate it. Keeping Rhode Islanders informed always matters. It matters now more than ever. I know a lot of you guys haven't had a day off, and I want to thank you for the important role that you're playing. I will say I just spoke at length about the violence that occurred in Providence last night. And, you know, people have said to me, you're going to keep this press conference today. The answer is yes. Life is going on. We're going to do everything we need to do to keep the people of Rhode Island safe and secure, and we will do that as we face this violence and unrest. Having said that, we are still fighting a global public health pandemic. We're still living with the virus. We are still, I want you to know, very focused on making sure that we're doing everything we need to do to keep you safe from the coronavirus. So it's important that you hear that. We're not going to let up at all. We're going to continue to do what we need to do with providing health care, contact tracing, testing, keeping you informed. The virus is still with us, and we're going to stay on that to keep you safe. So to that end, we're going to begin, as we always do, with the data on the screen. It is another good news day from that perspective. For the past few days, we've seen a positivity rate of below 5%. So that means fewer than 5% of the people that we are testing positive. That's excellent. I hope it stays that way. It's great news. Having said that, we watch it every day. The name of the game now for all of us is vigilance. We cannot get lazy. We cannot get our eye off the ball. It's easy as we start to begin phase 2 to get more relaxed. No. Stay vigilant. That's what we are doing. This is good news today. Hospitalizations down, test positive down. We have 101 new cases. So the virus is still with us, 101 new cases, and we watch it vigilantly. And very sadly, another dozen deaths. So as I come up before you every day and report 10 more deaths, 20 more deaths, 12 more deaths, I just continue to urge you to remember that these are loved ones in the state of Rhode Island, and every one of those deaths is hard for all of us to take. Yesterday was the first day of phase 2, and I'm very pleased to say that things went smoothly. No real issues to report. Most people are following the rules. We were out and about everywhere looking for mask wearing, crowds inside of stores, popped in on a few manufacturers, looked in on some offices, and I have to say thank you, thank you, thank you. Every business we went into, whether it was a manufacturer or a retail operation or a restaurant or an office building, people were wearing masks. We didn't see crowding. We didn't see people bunched up in lines. We hear most businesses are continuing to allow the majority of their employees to work from home, and they will be doing that through the fall. I appreciate that. You know, the message in phase 2 is If you can work from home, work from home. If you can't, obviously then go into the office and follow all the necessary rules. But really, yesterday couldn't have gone better from my perspective, and I want to say thank you for those of you who participated in following the rules to make Phase 2 a good success. I have been getting asked often at these press conferences about nursing homes, and so I would like to take a few minutes to share with you a little bit more information about what's going on in our nursing homes, exactly how we're meeting the needs of the crisis, and just give you a flavor for how we stack up to our neighbors. I will say that no one's ever gone through this before. This is the first time any governor of Rhode Island has had to do this. And so there's no rule book to follow, there's no playbook. So we're doing the best we can, and we're continuously improving every day, continuous improvement. Having said that, I do look all the time at our neighbors, every governor who's doing an excellent job, working hard, just to check in and see how we're doing compared to them. And with respect to nursing homes, although we are far from perfect and we have seen the vast majority of our deaths in nursing homes, we are doing as well as, if not better than, certainly our neighboring states. So just to review for you, 76% of all of Rhode Island's COVID deaths have occurred in nursing homes. That in Rhode Island, compared to 62% in Massachusetts and 57% in Connecticut. So that, the 76% of our deaths are in nursing homes, 62 in Massachusetts, 57 in Connecticut. So it is absolutely true, as has been pointed out by members of the press, that the percentage of our deaths in nursing homes is higher. And so the question has come, why? Why is that? And I think it was Brian Crandall who asked me, did I think that meant the situation in nursing homes is worse in Rhode Island? And I think it's a very fair question. Or does it mean we're doing a relatively better job than other states at containing the virus outside of nursing homes? So today I thought I would try to give you a bit of a clearer picture and give you an insight into how we are handling it. Let me first begin by saying, as I have said on numerous occasions, the situation in nursing homes across the country as it relates to the COVID pandemic is tragic. We saw it first in Washington State, and really in every state. We have all struggled to contain the virus and minimize its impact in nursing homes. And some of that is just because of the nature of the virus. The virus is particularly difficult for older people, and it spreads incredibly quickly in congregate care settings. What we know about this virus is that it is highly contagious and quite deadly for people who are older and who have a underlying health condition. Here in Rhode Island, learning from what we saw in Washington State, who was a few weeks ahead of us, and even in New York City, we took an approach to act very aggressively in our nursing homes to prevent what I think could have been much worse. We were very quick to prohibit visitation at nursing homes, and I do recognize that that has caused a great deal of emotional anguish and sadness for patients in nursing homes and their families. But we felt, and I still feel, even though it's a tough call, that that is necessary. We designated COVID-positive nursing homes with separate staff, separate entrances, and separate exits. We learned a hard lesson. At the very beginning, we were discharging COVID-positive patients from hospitals to disparate nursing homes. And, if we knew then what we know now, we would have immediately cohorted every patient in COVID-specific nursing homes. We learned quickly, we improved quickly, and now we have COVID-positive nursing homes. We were one of the first states in the country to test all the staff and to offer testing to all the staff and residents at all of our nursing homes, and I want you to know we are continuing that testing on a regular basis. Right now, we are in the middle of our third phase of testing. So we're right now in the middle of offering for a third time to every worker in every nursing home a test. It is our intention to do that on a continuous basis. We implemented infection control protocols, and we were, as far as I know, one of the first states to put what we are calling a congregate setting support team on the ground in these facilities. What is that? People have said, what are you talking about? The congregate setting support team, it's a team of people primarily staffed by the National Guard who go into nursing homes when we are requested. We have told every nursing home that they can ask for help. We've received 54 requests from nursing homes, and we go in, these teams go in on what they call missions, and they offer their assistance to nursing homes based upon what the nursing home needs. In the last week, they visited 6 nursing homes. They provide grief and trauma support for workers. Let's not forget that although some folks haven't worked very much in the past few months, if you're a worker in a nursing home, chances are you haven't had a day off. People that you've cared for a long time have passed away. You fear for your life every day you go to work. So one of the things we're doing, in addition to boosting the wages of the lowest paid in nursing homes, is we're offering grief and trauma support for workers. We are providing guidance on how to don and doff the PPE. Lots of people who work in nursing homes have never before in their career had to use this extensive PPE. And if it's not used properly, it's not effective, so we do a lot of training. We're helping a great deal with staffing, including working with Skills for Rhode Island to provide temporary staffing to fill shifts that have a shift shortage. So these are, this is going to be ongoing. We're using our National Guard and our COVID Relief Fund to provide this to nursing homes. Additionally, we've provided millions of dollars of PPE to nursing homes, and we will continue to do that. I will say this. Every day we try to get better. Every day we try to get better, and it's clear to me that we can continue to do more because we have still, it's still really difficult in nursing homes, and we're losing lives every single day. And so I'm committed to continue to do more. But I do want you to know that we are focused on this as much as we are focused on anything. Just a few statistics to share with you. Rhode Island has lost a lower percentage of our nursing home residents than our neighboring states. So on a per capita basis, we are doing better than Massachusetts and Connecticut. The data on that is in terms of fatalities per 100 beds. So what percentage of those in our nursing homes have we lost? Rhode Island is at 5.9%, Massachusetts is at 8.8%, and Connecticut is at 8.1%. So if you look at nursing home losses on a per capita basis, for every 100,000 people, Rhode Island has lost 64 people, Massachusetts has lost 96, and Connecticut has lost 107 people. Now, I want to be crystal clear about this. I am offering this data because it's been asked of me, how are we doing compared to our neighbors, and what are you doing? And I want to thank all of the folks on my team and all the nursing homes who've worked very hard to limit the loss of life. Having said that, 64 people is 64 people. Every life lost is a tragedy. Today we report more lives lost. 76% of our deaths have been in nursing homes, and we've lost hundreds of people. So we want to do better, but I can tell you with certainty that we are approaching this doing everything we know how to do, and I am so sure that the deaths would have been much more if we hadn't done all that we've done. And for me, as I look around to other states and other cities, I take some heart in knowing that at least on a relative basis, we're doing better than our neighbors, and clearly the actions that we've taken have absolutely saved lives. And for the families, I do hear constantly from families who have loved ones in nursing homes, I want you to have some confidence that this is top of our list. And it's also top of our list to make sure that at some point, you know, in phase 3, we can get you back in there in a safe way to visit your families. And also, as Dr. Nicole Alexander-Scott said yesterday, for assisted living, we're looking at that even more carefully on a one-off basis to enable some more visiting as soon as we feel it's appropriate. I want to make one more mention. Clearly, there's a lot of pain and suffering and anger in the world right now, in the country now, and Rhode Island is not immune to that. We're living every day, as we have for the past several months, with the pain and suffering and loss that has been caused by the coronavirus. And now, as we saw what happened, being attacked last night in Providence, there's pain and suffering across this city and across this state. I spoke at length about this earlier, and I have endeavored to keep these press conferences exclusively focused on coronavirus. And so I will do that, but I will simply say what happened last night in Providence was not a protest. Make no mistake about that. That was an attack on the people of Rhode Island who came here deliberately intending to be violent, cause harm, hurt people, and destroy our property at a time when we are already struggling. Going after our small businesses at a time when many of them are just barely getting back on their feet. So, as I have said so many times from this podium, I am asking you to be kind. And I'm going to say that again today. The kindness of the people of Rhode Island, first of all, it's who we are. We are a small state. We are a connected state. We're a state of communities and neighbors where we look in on our neighbors. Many people have said to me, Governor, Rhode Island is doing well managing the COVID crisis. Why is that? It's because we're looking out for one another. It's because when I get up here and say, please look in on someone elderly, you do it. Please wear your mask so you don't spread your germs. People do it. We're seeing 96, 97% compliance with mask wearing because you care about your neighbor. When we say, please deliver food to the elderly, it happens. So I'm going to ask you to continue to do that. I know you're frustrated. I know you're tired. I know this is so hard, and we've never lived through anything like this. I also know we've begun phase 2 successfully. We can see light at the end of the tunnel, and we have the strength within us to get through this crisis and to come out the other end stronger, more united, and more resilient. And that will happen if we are all kind. So to that end, I want to highlight the United Way. I've been up here a lot highlighting the United Way. The United Way is leading a Be Kind statewide challenge. Hashtag BeKindRI. Hashtag BeKindRI. It's a statewide challenge this month. They are asking you to share your acts of kindness on social media from now through June 20th using the hashtag BeKindRhode and inspire others to do the same. So let's take this challenge seriously. Let's do it. Get out there, post your acts of kindness, challenge yourself to do some acts of kindness, post it up there, and let that inspire others. Let that inspire others. The level of pain is real, but the level of our hope and resilience and kindness is also real. And although I stand before you a little tired and frustrated, I am more so filled with confidence and hope that we will come together as a community and do what it takes to keep ourselves safe and healthy and get to the other side of this crisis.